Welcome to AM Best Audio.
Heading into 2025, insurers faced a rapidly evolving Medicare Secondary Payer compliance landscape with new CMS policy updates. This presented several challenges for insurers on different MSP fronts. It's critical that insurers understand these new updates to help reevaluate and modify MSP best practices to stay compliant, reduce costs, and minimize potential liability. I'm John Weber for AM Best Audio, and I'm speaking today to Mark Popolizio, Vice President of MSP Compliance at Verisk, who recently published a Medicare watch list for 2025. Mark, so glad you could join us today.
Thank you so much for inviting me, John. I've been looking forward to it.
Me as well. So, Mark, what is Medicare Secondary Payer, and what are some of the challenges for this in the insurance industry?
Yeah, that's a great way to lead off on this, John. Medicare Secondary Payer, MSP, right? That's the buzzword that's tossed around a lot in insurance circles. You know, from a very global perspective, the Medicare Secondary Payer Act is a set of statutes and regulations that are on the books that are intended to maintain the fiscal integrity of the Medicare program. Okay, the statute was put in 1980, and one of the challenges out there from sort of a macro view is that the statute has been built upon and added to, et cetera, over the years. Some parts are out of date. Some parts don't make sense. Some parts seem to have been inserted without fully understanding how insurance practices work, claims practices, settlements, et cetera. So on the one hand, you have this complexity of a statute. And, we were joking a second ago that, many of the courts have decried the statute. Two funny quotes concerning the court's view of the statute. One court called it a model of unclarity, and another court called it the most impenetrable text in human history. So we start there with a statute and a set of regulations that have some challenges on a lot of different levels. Then CMS, the Centers for Medicare and Medicaid Service, this is the federal agency that's tasked with administering the MSP statute. Again, the whole focus of the MSP statute is to keep Medicare the secondary payer, to protect the fiscal integrity of the program. And on that front, the idea is that there's a form of other insurance on the block, be it workers' comp, no fault, med pay, liability, et cetera, called non-group health insurance, then they should be paying the freight to protect the fiscal integrity of the program. Now, this also has applicability and similar in different ways, sometimes in the group health space. I'm not talking about that today. I'm talking to the non-group health space today. And CMS, as part of administering the Medicare Secondary Payer Program, comes out with different policies and approaches and processes to follow that sometimes can be burdensome, maybe sometimes may not fully contemplate or understand, again, the claims or settlement practices, and insurers have to adjust to this. And sometimes there could be delays. Maybe going from A to Z isn't the hallmark of either the MSP or some of the CMS practices. So overall, this creates frustration for insurers. This creates complications for insurers. This creates expense for the insurers. This also creates pockets of potential liability. And what's ironic about it, John, and I'll conclude the first point on this, is that the concepts of Medicare Secondary Payer compliance are rather simple. There's basically three, right? So the first one is called Section 111 reporting. And in a nutshell, and this is important for us as we go further today, this Section 111 reporting law requires insurers to report cases and settlements to CMS that involve Medicare beneficiaries electronically. Okay. And CMS gets a ton of data about the case. So from CMS's view, they now know about a claim out there that has a Medicare beneficiary. Compliance area number 2, conditional payments. This is all about reimbursing Medicare for stuff they paid for that they believe is related to the underlying accident or illness or claim. Okay, they paid for it, but they see this as being the responsibility of another insurer. the workers' comp insurer, the liability insurer, the no-fault insurer, and they want to be reimbursed. And then the third area, which is really more of a workers' comp area, is called the Medicare set-aside. And in this area, parties, quote unquote, set aside a sum of money from the workers' comp settlement that the claimant is to use post-settlement for his or her accident-related treatment that Medicare would otherwise cover. So think about it. So through 111, CMS knows about cases out there that involve Medicare beneficiaries. Conditional payments is about reimbursing Medicare, right? And Medicare set-aside is about the future, making sure Medicare doesn't pay for stuff that is related, say, to the comp case. And really, the common denominator is they're trying to protect the fiscal integrity. A little long-winded on question one, but I think necessary for the audience to just see it in the bigger picture and to understand our conversation as we go further.
Customize your data experience. BestLink now offers an interactive company dashboard that provides company-level intelligence in a fast, user-friendly interface featuring interactive tables, charts, and Sparkline performance histories. Customize the dashboard tiles to prioritize the insurer ratings, data, and analytics that best support your workflow. AM Best. Our insight, your advantage.
Very informative. So then tell us about some of the key changes taking place this year, Mark.
Yeah, we had a bumper crop of a year in terms of changes in the Medicare secondary payer space for insurers. Number one, the Section 111 reporting, right? I just mentioned that to you. And, it's all about insurers sending data to CMS electronically. And there's a big penalty over the insurer's head if they don't do it properly or timely. Okay. For example, currently insurers could be charged up to $1,474 a day per claim if their 111 reporting is not submitted timely. And the big thing this year, John, is in October of this year, after the law being on the books for 15 plus years, CMS is finally getting ready to start penalizing insurers. So come October this year, if your number's right, CMS believes maybe you've reported your Section 111 settlements or situations where you have responsibility, other situations where you have responsibility to report. If it's untimely, you could be assessed a penalty. And that's across the board. Comp, liability, no fault, bed pay, PIP, whatever it is. Everyone's in the same bucket. Now, from a different angle, and now these next three things are huge, and they really only affect the workers' compensation insurer. Okay, there's three things. Two of them just went into effect. Number one, April 4th of this year, CMS went live with their something called TPOC MSA reporting. Now, TPOC, total payment obligation to the claimant, that's a 111 term. And that is what CMS uses for the idea of a settlement or a judgment or an award with the Medicare beneficiary. And if you have one of those in the 111 system, you report it to CMS as TPOC. Now, the significance now, this new TPOC MSA reporting, is that CMS has expanded the traditional data fields that they've historically wanted reported as part of these settlements or these TPOCs to now also include information and data about whether the insurer included a Medicare set-aside as part of their settlement involving settlements with Medicare beneficiaries. So before this, they never really had that type of visibility through the 111 reporting system. Now, they may have known about certain Medicare set-asides if parties sent them to CMS for review and approval, but more globally, they lacked that visibility. They now have it through this 111 program, TPOC MSA reporting. So now CMS, for the first time, will know through this reporting what an insurer has done regarding the MSA with respect to settlements with Medicare beneficiaries. Very significant, John, because now they finally have a way to gauge that. Two, and this one is probably positive, April 7th, CMS eliminated the 1-year waiting period for parties to file what CMS calls an amended MSA review. So let me set the stage. So a lot of times in the workers' compensation space, parties will submit their Medicare set aside if it meets CMS's criteria to CMS for review and approval. Okay, still a standard practice. You don't have to submit if you don't want to. It's a voluntary program. A lot of insurers do this because if they get CMS's sign off, everyone feels secure that what they did passed muster. Okay, now, problem though could be that when you submit your MSA proposal to CMS, they could reject it and require additional monies. And when that happens, oftentimes, this happens to be in practice, what happens is the higher MSA amount that CMS wants ends up killing the settlement. You keep the case open, the case drags on. But as the case drags on, circumstances change. The claimant's health condition improves, he stopped treating, he's off the expensive drug, had the surgery, etc. And so now the idea is, well, wow, the set-aside amount is now even more ridiculous than it was when CMS first gave it to us. We should be able to go back to CMS and say, there's a change of circumstances. Here's a new MSA. That's amended review. Okay, CMS gives you a second bite at the apple. But up until April 7th of this year, you had to wait 1 year for when CMS gave you their approval to do this. Good news is, as of April 7th, the 1 year period is over. You no longer have to wait to file an amended review. So if you believe you meet certain criteria, you can always contact me. You can then file your amended review. This is viewed very positively in many quarters of the MSA workers' comp space. And the third one, this one goes into effect July 17th of this year. CMS is getting out of the business of reviewing and approving zero MSA. So a second ago, I told you that CMS has these review thresholds. If you meet them, you can submit your MSA proposal to them for review and approval. Okay. And sometimes when you do that, you may go to CMS and say, hey, look, my MSA is zero. We believe we have a legitimate basis not to include future monies as part of this settlement. Sometimes it could be a medical reason why. A lot of times it's a legal reason why. We've denied the case, okay, from the beginning. It's a denied and disputed settlement. We're coming to you because we meet your review threshold, but we believe the set aside should be zero. Now, this has been tricky, frustrating, and aggravating for years because getting these zero MSAs were a little bit difficult with CMS. So I guess for some will view this as good news that come July 17th, CMS says, we're out of the business of reviewing and approving these zero MSAs. Importantly, though, you can still do and have a zero MSA after July 17th. But CMS cautions on 2 points. One, make sure you maintain documentation in your file for supporting evidence in the event they ever audit you or question you. And secondly, they counsel and direct parties to Section 4.2 of their MSA reference guide to review the criteria that would give support to this to a zero MSA inclusion. Now, in the bigger scope, why this is also important, and I failed to mention this when I talked about the TPOC MSA reporting. CMS reserves the right to audit zero MSA's values as part of the TPOC MSA process, and they also say they could resort to False Claims Act if that TPOC MSA isn't followed. Okay, so we got three in summary: TPOC MSA reporting requirements for workers' comp settlements with Medicare beneficiaries when it's effect April 4th. Second, CMS removed the 1 year waiting period to file an amended review submission. Second bite at the apple, a new MSA on cases that are unsettled and meet certain other criteria. That went into effect April 7th. Coming July 17th, CMS will be out of the business of reviewing and approving zero MSA submissions. You can still have them. Make sure you're consulting Section 4.2 of the reference guide and make sure you maintain documentation in support thereof.
What can insurers do to be prepared to meet MSP CMS challenges and calibrate their internal processes?
Yeah, this is a great question. And this is one of the areas I have a great job. I mean, I get to write, I get to speak, I get to do stuff like this here today. But one of the areas I also enjoy is working with insurers on this very question, John, right? So what we're really talking about here, from my viewpoint, is really, shutting the doors, turning off the phones, and making sure, number one, that the core obligations of the Medicare Secondary Payer Act and CMS's policies to enforce the Medicare Secondary Payer Act are understood. You gotta understand the three buckets I talked about: 111, liens, conditional payments, which I haven't really talked about today, and the Medicare set aside. That's one. Two, from there, you have to build practical best practice protocols that recognize where your potential liability could be and how it is that the frontline adjuster is going to navigate the process to make sure Medicare's interests are properly addressed. Okay, now as part of that too, it's not just making sure that Medicare's interests are addressed, which is obviously important because you don't want to find yourself in court with them, double damages, interest, and all different types of weapons CMS has, right? But you also need to understand what steps you can take to mitigate and reduce your liability, going forward on such things as the Medicare set aside. There could be steps that could be taken to lower that number. There could be steps taken to challenge a lien claim, a conditional payment claim that CMS can have. So that has to be built and baked in to the process. And this is huge, the third one. And I see so many great programs that are put together, but then it falls down because it's not communicated properly to the frontline adjusters and defense counsel, right? So, it's not just about erecting these great programs, but it's making sure that the frontline folks that are battling the battle every day understand what your expectations are, understand how the process goes, understands what they must do. And the fourth thing, and I'll add this, I said three, also, we have to know what type of technological capabilities are out there to simplify this process for the adjusters and let them concentrate on stuff that it may be a better use of their time. Medicare, it's a good use of the time because of the liability you face, but there are technological systems and advancements that are out there every year, something new that could help this make this go better.
Mark, what is one simple thing from your experience to make Medicare compliance work better?
Yeah, don't wait. It's not like fine wine, John. This stuff doesn't get any better over time. And I see this a lot, especially in the liability space. They wait to the day of the mediation and the settlement to try to figure this out. Is there a lien? Is there not a lien? Et cetera. And, they're shooting in the dark. On the workers' comp front, do we need a set aside? Should we get one? Stuff like that. In the long laundry list of items as part of claims handling practice, as part of settlement practices, et cetera, you have to have Medicare on the radar. And the sooner it's on your radar, so if it's out there, it's not going to be every case, right? Soon as you know that it is a possibility, you need to be asking yourself the three questions. Will I have a reporting obligation in Section 111? Could I face a potential conditional payment lien claim? Do I need a set aside? Okay. And the sooner that's done, the better chance you have of reducing your liability, getting the case settled, and saving some money.
Don't wait. Great advice. Mark, thank you so much for taking the time to speak with us today.
Thanks for inviting me.
That was Mark Popolizio, Vice President of MSP Compliance at Verisk. And I'm John Weber for AM Best Audio.
Looking to get the full attention of the insurance industry? We have the platforms that will do just that. Whether it be AM Best TV, AM Best Audio, Best Review Magazine, or Best Day. Find out more by calling AM Best Advertising Sales at 908-439-2200, extension 5399, and have a great day.